Hello, welcome to the Health In Show, an affiliate program of Homeopathy World Community. You've come to the right place to tune in and participate with your comments and questions. Love is the greatest healer of all, but sometimes, in order to change our emotions, we must take action in other spheres of our lives. We speak with experts in alternative and complementary health fields and hope you will benefit in some small or great way. Remember, you are wherever your thoughts are. Make sure your thoughts are where you want to be. We're starting. Can you see me?
Go.
Go. Here we are live. June 23, it's 2014. I almost put you in a different century there. We are getting started with the Health In, and I appreciate everyone who has joined us today. I see there's a bunch of people over there in the chat, and we are waiting for Dr. Golden, Dr. Isaac Golden from Australia, who is one of the world experts in homeopathic prophylaxis. And I see that Rochelle and perhaps a few other people don't even know what this is all about. But for instance, if there is an influenza outbreak, an epidemic, and you are worried about it, I'm getting feedback. Oh, it's probably from someone in another room. If you're worried about it, then you would be able to take influenzinum or oscillococcinum or even gelsemium, all of these homeopathic remedies that would ease your anxiety, ease your fear, support your own immune system so that you could either prevent having the illness, or you might have a very mild response to it and let your body just recover very quickly. There are people out there like Kate Birch and Cilla Whatcott and others who are following his lead, Dr. Isaac Golden, who has been studying probably 20 years now in this field of homeopathic prophylaxis, where he gives a regimen of homeopathic remedies to young children to educate their immune system. And basically he does that by giving a specific set of homeopathic remedies for a set of potentially contagious diseases that might be coming through the area. And this can be tailored. So some of the books that you might be able to get would be The Solution, this book by Kate and Cilla, can be found. There might be a link on Homeopathy World Community. It's called Homeoprophylaxis, the Vaccine Alternative. And the reason that they put this together was because so many parents were concerned about the responses of vaccinations in their children and the number of adverse events that can occur, just everything from regression in maturation of the child's ability to communicate, to have fine and large motor skills, to speak, and even losing their vocabulary that they had already established. So many difficulties in development of these children, and the reason that you can imagine is the ingredients in the vaccines that we have today. And I see that somebody's sending me an email message. Hello, Barbara. I want to wave to everybody, Dr. Bidou, to Kathy, Rochelle, and Katz. I don't know who Katz is, but everyone for joining me today. So if you just educate yourself, and this is one of the things that the medical community has a an army of people who are out there writing articles in the mainstream media and blogs and telling people that we are scaring people with learning about vaccines, with self-educating us, with going to the CDC site and just reading the ingredients. If you read them, then you can begin to wonder, is it safe to inject in a newborn, in a growing child, these neurological ingredients, the toxic ingredients, aluminum. These are metals that do not belong in the body. Thimerosal or mercury, other kinds of adjuvants that stimulate the body to respond as a hypersensitive reaction. And therefore, I was just listening the other day to a mom who said, how many people know that peanut oil is an ingredient? And we've never seen children allergic to peanut butter or peanuts. This is very unusual, and it's changing the whole life of schools and children and interaction. So we need to take a closer, serious look at it. I wanted to let you know a little bit more about what is here. And if anybody would like to call in, there is a number, 919-518-9773. I'm here flying solo today, or you can call on Skype at Computers 2K Voice. And I would love for you to call in, send us your live stories of what's happened to your own family, to your own children, or give us your take on it. If you are using homeoprophylaxis, there is this series of remedies that are being given. Let me pull up the other. It's called Free and Healthy Children. This is the program by that Kate and Scylla are using. And in this, it's really very simple. We're not giving a ton of different remedies. We're just giving something for pertussis, whooping cough, for oh, Dr. Golden just beeped me. So we're going to tell him to try and get in. Let me send him a message. Where did he send me? If
This was a Skype.
Oh, it was a Skype
chat.
note.
Yeah, that's
okay.
the tone
okay.
of Skype.
Okay. Oh, I have to find him. So do you have his
you keep going.
Okay. So I'm just telling him to call you. Okay. So we are still live. We are still here. Rochelle is saying UK, and the only patient today didn't show, so she's able to take care, be out in the garden, and everybody who can get out in the garden and get into the dirt. We need not to have a sterile environment. We need to populate our gut with all different kinds of bacteria and our skin with all different kinds of bacteria, so that and even viruses, I suppose, but bacteria, so that we are familiar, we are knowing who our neighbors are, and not being so sterile that we cannot handle and cope with our environment. We want to be strong, and through this strength, we will become a better community. I also wanted to tell folks that, we get these notices in the news, if anybody's listening, about things like what's going on in the labs. There's a news, Safety Foul-up exposes CDC staff to anthrax. So they're playing with all of these deadly, contagious diseases in laboratories, and we really don't know what they're doing or how they will escape or who will be affected. And in this way, we are changing the natural environment. And we're still waiting for Dr. Golden. I don't know if he's with us.
He's connected, but Dr. Golden, you need to start. You need to. Good morning. Good evening. You need to start your video and If you don't know how to do that, right under your picture in Skype, there is the camera icon. Toggle it back and forth. Do you see your picture in Skype? Or do you see any picture in Skype, Dr. Golden? Oops. Dr. Golden?
Hello?
Hello.
Yeah. I can't see anything with an icon.
Dr. Golden, do you see any picture in Skype?
I just see your symbol.
The what?
And your CSK, is it, or something like that?
Your logo.
Your logo, yeah.
Okay, below that, do you see 4 big icons like a red phone?
Yep, I can see a red phone, a plus, a microphone.
What is on the left side of that row?
Show 1M and hide contacts.
Is there no icon of a camera?
I can't see any icon of a camera, no.
Do you have a camera?
I can see Debbie.
Do you have a camera?
Yep.
Well, then there's a problem with your Skype. Okay, well, we can
and look,
go
I'm sorry about this timing. I thought it was going to be at 1 o'clock my time in the morning, and all of a sudden you must have started very early. My humble apologies.
I was concerned about you, Isaac. I didn't want you to be up at 1 a.m. And so I sent an early email for
I didn't get that, Debbie. I really do apologize. Yeah, that's is why
okay. We're good.
I've just turned on my camera and
I don't. Do you see the camera below whatever you see in Skype? On that row of big icons, there should be 4 of them.
No, there's only 3.
Okay, so the one to the left of the mic should be the camera. And if it's not there, that means that Skype is not seeing the camera.
Okay.
So
Skype's not seeing the camera, I'm afraid.
Right.
I don't know if I've got a loose connection somewhere or...
That's okay. Don't worry. We have your picture here. And
do you have the overheads, the PowerPoints that I sent?
Yes.
Yes. So you guys go ahead and you can talk. Never mind.
Yeah,
leave things as they are. It's okay. Stop scrambling.
Okay.
Here we go. Go ahead.
Okay. So I want to welcome Dr. Isaac Golden of Australia. He is the lead in homeopathic prophylaxis. And I tried to give a little bit of a definition of what that is. It's a program for maintaining the body's health and immune system through infectious disease and making us stronger as a total community and population. He's been involved in many studies over the last 2 decades. And recently, Dr. Golden, you did a survey as well. So
yes.
You go ahead and speak, and I'll give the floor to you.
Okay, thank you. And to all the audience, once again, I do apologize for the problem with our communications and my misunderstanding of the time. Look, the survey that you're talking about is being done through Federation University in Australia, where I'm an honorary research fellow. And the aim of it is to eventually try to get to a consensus position on homeoprophylaxis around the world. Now, that's almost an impossible undertaking because there are many, many diverse views of that around the world. But it's an aim, and I've been very fortunate to get the cooperation of Harry van der Zee, the editor of Homeopathic Links. I'm doing a series of 5 or 6 articles from last year through to 2015, looking at different aspects of homeoprophylaxis. And this survey that we started through the university with the support of Homeopathic Links is one of the important stages in it, because we need evidence. We need evidence as to the actual attitudes towards homeoprophylaxis and the use of homeoprophylaxis around the world. And the first survey, the first part of the survey, will be published in full in September edition of Homeopathic Links, but we've basically done most of the number crunching, the basic number crunching, and it's been very, very interesting. And one part of the PowerPoint which I sent through to you has actually got the some of the results there. And what they show is that the positions in different countries around the world are quite different. And for example, the Australian position is totally different to the English position. The American position is somewhere in between. And so we're actually starting, or we've put in for an ethics committee approval to do a second survey to actually fill out the results even more, because the first survey in some ways gave us more questions than answers. It left a lot of information still to be gathered. And so we're going to be launching, we hope, a second part of this survey coming up soon. And we're hoping by the time we finish that, we'll have a really good understanding about the different attitudes around the world to homeoprophylaxis, and try and see what we can find in common that people are sharing, practitioners are sharing, or where they're disagreeing, and where there are disagreements, whether or not we can add sort of information, research, data to try and resolve some of the misunderstandings or disagreements that do exist. So it's a big undertaking. We had responses from people from 34 different countries to the first survey, and we're hoping that that will expand, with the second one. I don't know if you want to put the overheads up, Debbie, or so people can have a look at what I'm talking about.
Sure. Just let Amnon know which of the slides you want to show.
It's the first, well, the slide with the, there are two slides with a lot of figures on them, data on them.
Okay. Go ahead, Amnon, and start with the first slide. And
well, I started with the first one. This is just an introduction.
Yeah, right. So it's about the third or fourth one in, Amnon. It's one with a table. The first table.
Okay, there it is. There it is. It's there. Go ahead.
Okay,
it's
so
there.
now I have a question, Dr. Isaac Golden. My question is, this survey went out to homeopaths, naturopaths, healthcare workers. Who received and filled out this survey?
Basically, we were looking at homeopathic practitioners, and so we contacted associations, and there was information sent to different associations, and also there was material sent via Homeopathic Links. There were a couple of mailing lists that cooperated, and then in the last few months of the survey, when we weren't getting the numbers we were hoping, I actually trawled through association lists of America, the United Kingdom, Australia, New Zealand, and Canada, ones that were in English, and got what I could from the association lists. And that's why those countries are featured in the table. Now, unfortunately, I'm not seeing what you've got there, but I'm assuming it'll be similar to what I have here. But have you got a table with a heading combined, then USA, UK, Australia, New Zealand, and Canada?
Yes.
Yes, we have a table that shows total responses combined USA, UK, Australia, New Zealand,
Yep.
Canada, and
So is that showing up to the people on the webinar? The people.
yes, it is now. It's there
Right.
now.
Okay. So maybe if I can just talk to this a little bit, just to show people what we're talking about. We had a combined number of 738 usable responses. We actually had over 1,000 responses, but unfortunately, a significant number of people either didn't fill in the questionnaire completely or sufficiently for us to be able to use it. So 771 altogether were usable. The next line down, experience, shows the average length of years in practice, almost 15. And, you know, that's a reasonable, it's a reasonably good average in terms of people's experience using homeoprophylaxis. So we were dealing with people who knew what they were talking about most of the time. Now, the first interesting question related to whether or not practitioners wanted to prevent potentially serious infectious diseases. And it's a very interesting thing that quite a number, 10% on average, said no to that question. In other words, these people were saying we shouldn't try and prevent infectious disease. Instead, we should let the person get it and then treat. Now, this is a very, very classical, if you like, homeopathic position. You can see that the UK respondents, many more people held that very classical position. 82.7 said yes, we should. So that means effectively 17% said no, we shouldn't prevent infectious diseases. Whereas in New Zealand, it was only 2%, in Australia about 3%. So that's the sort of difference that was showing up between the different countries. And then for people who said yes, we should prevent infectious diseases, the next big question was, how should we go about it? Should we use general protection or disease-specific protection? So general protection is basically trying to make the person as healthy as possible through constitutional treatment, as well as things like good diet, herbal medicine, supplements, etc. Disease-specific prevention is actually targeting a particular disease. So rather than trying to make a person as healthy as possible, we're saying, okay, we're really worried about, say, meningococcal disease or pneumococcal. So we'll target that with something very specific for the disease. And once again, we found that the United Kingdom practitioners were much more likely to use general protection than disease specific. Looking down a bit further, then we gave three choices for people who said, yes, we want to use disease-specific protection, either vaccination, a combination of vaccination and homeoprophylaxis, or homeoprophylaxis only. Now, it was overwhelmingly very, very few homeopaths would use or support the use of only vaccination. But it was quite interesting that about a quarter were certainly interested in looking at some combination of homeoprophylaxis and vaccination, whereas about 3/4 were looking at HP. And the final question in that section was, okay, if you're going to use homeoprophylaxis, will you use it any time or only during epidemics? Because some people say that, okay, we look at Hahnemann, he started using homeoprophylaxis back in 1798, but he only did it when there are actual outbreaks of the disease around. Whereas other people say, well, okay, I don't know if it's the same in America, but in Australia, we know that whooping cough is around in the community the whole time. So even though it's not necessarily in epidemic proportions, there's always a background level of it. So people like myself will say, well, if you're concerned about whooping cough, it makes sense to cover against that all the time, because the question comes up, if you say you should only use it during epidemics, when does an epidemic actually start? How many children have to become unwell to declare an epidemic present so that you then decide you're going to use immunisation, homeoprophylaxis or vaccination? So these are the sort of things that are being raised here. And once again, we see quite a difference between countries. So America, for example, is a strong supporter of homeoprophylaxis, as is Canada. And we find that in Australia, there's a good level of support, but it's actually it's above England, but it's, not as strong as, according to this position statement, as some of the other countries. But when we go down to use a bit lower on, we'll find that it is stronger. So there were potential inconsistencies in the data, and this is why we've decided to do the second study. Maybe if we go down, we miss position 2, we just go down to use of HP, because this also brought out some interesting findings. What it basically is saying is that 58% on average of homeopaths use homeoprophylaxis at the moment, and another 10% intend to use it. So you're looking at almost 70%, certainly 2/3 of homeopaths use it. Now, that's quite different in different countries. So in the United Kingdom, the total currently use and intend to use is only about 60%. In Australia, it's in the 80s, as it is in Canada. Also in America, we're looking at about 75%. So there's quite a bit of difference between the different countries. The New Zealand use is also quite low in the 60s. We find a little bit lower down where it says other, we ask the question, have you actually read Hahnemann's essay on homeoprophylaxis? Now, there were very big differences here. The majority of homeopaths hadn't. So only 40% on average had read Hahnemann's essay back in, he wrote it in published it in 1801, but it was about his experience using belladonna to both treat and prevent scarlet fever back in 1798. And only 40% of respondents had read that. We find that in Australia, it was 60%. In New Zealand, it was less than 30%, and in the United Kingdom, 35%. So there were big differences between countries. And even though it's not showing up on this graph, when you actually plot relationships between having read the essay and use of homeoprophylaxis, you see that there are very strong correlations, that there's a strong correlation, positive correlation between having read the essay and using HP, and there's a negative correlation between having read the essay and unsure about whether to use it or not. So a person who's read the essay is more likely to use it and is less uncertain about how to go about preventing infectious diseases. So the education of homeopaths in particular, but of course any complementary therapist who's interested in this sort of using homeopathic immunisation, and you don't have to be a homeopath to actually use it, then certainly what we find is that the education, knowing what Hahnemann did the very first time homeoprophylaxis was ever used, makes a big difference in your confidence and in your decision whether or not to use. We also see a correlation there between having read Hahnemann's essay and belief that homeoprophylaxis is based on the law of similars. Now, if we can go to the second page, please, of the... Oh, sorry, I think I've got a different layout here to what I've sent you on the PowerPoint. Unfortunately, plugging in my headphones means I can't plug in my hard drive, my external hard drive where I've got what I sent you on. So I'm not working from exactly the same data. But any questions about that material so far?
We have a ton of questions in the chat.
Okay.
One from Phyllis, I assume it's Phyllis Georgic in homeopath in Pennsylvania, says that belladonna is a regular homeopathic remedy and not a no-sode. And I don't know that there's a difference between utilizing just regular remedies or nosodes in terms of calling it homeoprophylaxis.
Yeah, that's a very good question. There are two types of remedies or two types of ways of using homeoprophylaxis, either nosodes or what we call genus epidemicus remedies. And belladonna is what we call a genus epidemicus remedy in the sense that it's a remedy that can be used to treat the disease as well as prevent. So Hahnemann's first use of homeoprophylaxis was using genus epidemicus remedies. And this is one of the things that in the second survey, we're actually asking a lot more questions about, because there were some people actually, if you look at that table where it says oh no, I don't think it'll tell us about that. Yeah, that there was another part of the survey where we had a question about that, but it didn't really fill out the answers completely. Oh, I know. This is, sorry. If you look back at the table in position 2, can you see that where it's got 1, 2, 3, 4, 5, 6 different positions on that table? Sort of halfway down.
6 different positions of what?
So what, number 1, treat, don't prevent. Number 2, prevent constitutionally. 3, vaccinate. 4, HP and vaccination. Can you see that? Or it might be on the second page of tables.
Yeah, that would be on the first chart, I believe.
Yeah,
Don't treat,
but it only
don't
goes,
prevent.
but it only goes down to 2. We don't see anything.
Slide number 3. Slide number 3.
So go to the next slide. Have we got that now?
No, there are no numbers there.
Amnon,
well, no,
slide
just
number
the next slide.
PowerPoint.
Are there other ones that have? No. Okay, there are 2 with tables.
Yeah, so the second page of the tables.
Here's the second one. It'll get there. You can talk about it. It'll.
Yeah, that's it. Okay, so it says the one previous, Amnon. The one that says 1, don't treat, don't prevent. 2, prevent constitutionally. 3, vaccinate. 4, homeopathic prophylaxis plus vaccination. Number 5, HP during the outbreak and HP at any time. So that there are many different options. It's the previous slide, Amnon.
No, that's good. Let's keep on that slide. So what we're basically looking at in terms of the question that was asked about the genus epidemicus is that even though it won't be a perfect correlation, a lot of people who selected number 5, which is saying only use homeoprophylaxis during an outbreak, would also be supporting the use of genus epidemicus remedies as opposed to nosodes. Now, this is quite a contentious issue amongst homeopaths. Some homeopaths say, yes, it's fine to use both remedies, both nosodes and genus epidemicus remedies. I certainly fit into that category. Other homeopaths say, well, you know, if we just look at what Hahnemann did, he used belladonna during an outbreak of scarlet fever, so we should only use genus epidemicus remedies during outbreaks. There's a couple of problems with that position in practice. One is that a number of children have to become sick before you can actually decide what the genus epidemicus remedy is. Whereas with nosodes, unless the strain of the disease is causing significantly different symptom picture, then you can use the nosode ahead of cases becoming unwell. So it's a simple question that parents will ask practitioners. Does my child have to be one of the children who falls unwell before you, the practitioner, can work out what the genus epidemicus remedy is to give me protection? I want protection now for my child, not after they've maybe fallen unwell. So it's an interesting practical question that has to be considered. The other thing is that very often you can have a number of genus epidemicus remedies through a particular outbreak, and it's a bit of a question it actually came up. This is just to give you a little example, Debbie. Last time I was in Cuba, I was talking with Dr. Bracho there when they were formulating their combination remedy for dengue fever. And dengue fever is a very difficult disease to actually construct a homeoprophylaxis remedy for, because it has a whole lot of different stages. Not only are there 4 different strains of dengue fever, it's a very big difference in symptom outcomes the first time you're infected and the second time. So we were looking at remedies like Eupatorium perfoliatum, which would be a common genus epidemicus remedy in the first stage, and then looking at some of the reptile remedies, which would be more commonly used as genus epidemicus remedies in the secondary stage, where you may have hemorrhagic fever. So the big question is, what do we do in a situation like this? Now, what the Cubans do, they mix it all in together. So their prophylaxis remedy for dengue contained potencies of the 4 major strains of dengue, plus 2 or 3 genus epidemicus remedies. But this whole issue is very controversial. Now, I know that some of the very classical homeopaths listening will be turning sort of white or red, maybe, more to the point, when they hear me talking about combination remedies. And I totally get it, because in my own program, I always use one single remedy at a time and space the doses at least a month apart of different remedies. I'm not a combination prescriber myself. So it was a challenge for me when I first heard about what they were doing there. But let's face it, what they're doing works. And, you know, we have to be practical people, not just theoreticians. And that really does work. So that was a very long-winded answer to the question about belladonna. But yeah, belladonna is not an ozone, but you can use, for scarlet fever, you can use a remedy like belladonna, or you can use the nosode of the organism.
Oh, well, we have so many questions. I'm going to be able to give you the chat notes after our talk, and maybe this will also stimulate some more of the questions for your up and coming surveys.
Okay.
We have so many questions here. Things like, the fine line between when does a contagious disease become an epidemic? And in that light, we don't even know allopathically using vaccinations what it is doing to these children or to communities with the use of so many vaccinations. And to think that the fine line, like let's say the parent does not want their child to come down with a contagious disease, and so you give remedies. Well, would that child have gotten the disease in the first place or not? We don't really have an answer to something like that.
Exactly. I mean, this is one of the very difficult things with immunisation and options with immunisation, and that is that we are dealing with uncertainty, and we're dealing with options which are not 100% effective. So you're quite right. We don't know if a person's going to be exposed. We don't know if they're exposed, if they'll get the disease. We don't know if they get the disease, whether it'll be subclinical or whether it'll be very severe. And we don't know that if we use certain types of immunisation, whether it be homeopathic or allopathic, whether that will work. We do have a fair idea about the potential damage that can be caused by the different methods. But in terms of everything else, we are dealing with uncertainty here. Anyone who thinks that any form of immunisation guarantees anything is just misunderstanding, because it doesn't.
Right. And with allopathy and the traditional vaccines that are given, one of the major reasons that people don't want to do it is because of the adverse events, which are becoming more and more prevalent, and the number of vaccines, the frequency that they're being given, and the damage to children, which very slowly, I think it's getting out into the mainstream world. As much as they push back against saying that these vaccines are supposedly tested and completely safe, we don't have all the data on that.
Absolutely. In fact, a colleague from Federation Uni and I have sent an article to Vaccine, the journal, the Orthodox Medical Journal Vaccine. And what we did was reply to a study or another meta-analysis, which was just recently published in the last month or so in Vaccine, proving yet again that there's no link between autism and MMR. And what the authors did, they looked at 10 studies, which they believe were high quality studies, and they did a meta-analysis of these studies. But what my colleague and I have pointed out is that when you look at each of the 10 studies, not one of them compared fully vaccinated and fully unvaccinated children. In other words, they were either trend series of vaccinated children, or they were comparative studies of one group of vaccinated children with a differently vaccinated group of children. For example, when they were saying that MMR vaccine was safe, they'd look at the incidence of autism in children who were vaccinated, including the MMR vaccine, and children who were vaccinated but not including the MMR vaccine. Well, all that proves is that children who are vaccinated with different vaccines have similar rates of autism. It doesn't prove that there's no link between vaccination and autism. To do that, you have to compare children who have received no vaccines. And that has never been done in the Orthodox literature. So we've replied to that recent large meta-analysis in Vaccine magazine, and we'll see if they publish our article. It's relatively brief. It makes a very simple and clear point that what the authors of these other reports are claiming to prove, they're actually proving something, but they're not proving what they're claiming to prove. That's a very important point. Did that make sense, Debbie?
What are they proving? That's a good question.
Well, what they're proving that autism rates are similar between differently vaccinated groups of children.
Mm-hmm.
Okay, so all that is saying is that if you vaccinate your kids, there's a certain incidence of autism, and it doesn't matter that much which group of vaccines you use. But that doesn't prove that if you don't vaccinate your children, you have a greater or a lesser chance of getting autism, of your child getting autism, than if you do vaccinate. And that's the question that needs to be asked. If you're making a claim that there is no link between vaccination and autism, the only way you can prove that is comparing children who are vaccinated with children who aren't vaccinated. And that's not been done.
And there's a wide spectrum also of the diagnosis of autism and the diagnosis of many other diseases. I mean, that's just selecting one specific disease diagnosis as opposed to other kinds of minor or lesser developmental issues or functioning issues for a child, socially, emotionally, mentally, and physically, that have not been investigated or made a connection to the use of injecting neurotoxins, is what I believe we are doing by giving the number of vaccines into these children. We have a question also in the chat concerning continued use of nosodes and proving of them. And which, to me, I think maybe you can elaborate a little bit more. When using homeoprophylaxis, it's not a continual giving of these homeopathic remedies every day or monthly or weekly. They're just maybe you can give a little bit of information about that.
No, that's a very, very good question, actually. And part of my doctoral research back in 2004, I specifically addressed this question because it's a very, very important question and a very good one to ask. Firstly, you are correct that if you're looking at, say, an individual disease in my long-term program, I'll give a single dose A month later, I'll give a triple dose, and then I won't give another dose for that disease for a year. Now, you know, that's not going to lead to provings except in highly sensitive children. And so that's one of the reasons why I set the program up like that. But more importantly, the question is there any evidence that using a program like mine, which does involve different nosodes over a period of years in high potencies, does that cause any weakening of the overall immune system? So what I did, and I think we've discussed this in one of the previous webinars, but I'll go over it again. I basically looked at children aged between 4 and 14 years of age. I looked at 5 different conditions: asthma, eczema, allergies, ear problems and behavioural problems. And I looked at 4 different categories of immunisation: homeoprophylaxis, vaccination, constitutional prevention. They're the people who say, you know, prevent by making the child as healthy as possible in general, and people who did nothing at all. And so that gave a matrix of 20 possibilities. And I had expected that the constitutional group would have been the healthiest in terms of having the least incidence of those diseases over the period of the children's life. And in fact, the homeoprophylaxis group, they were just as healthy, measured in that way, as the constitutional group. And what that really showed was that there was no evidence that using an appropriate homeoprophylaxis program caused long-term health issues. And there's an explanation of why in Hahnemann's own writings when he talked about doing provings. He actually said that if you do provings properly, it will help to stimulate and improve the person's health. So a homeoprophylaxis program similar to mine actually does challenge the immune system, but in a very, very subtle way. And the evidence that we have so far, I mean, let's face it, this is only one study, but it's the only study. That's the problem. We don't have any other data. But this study definitely indicates that there's no evidence to suggest that it causes problems.
Very good. You know, if anybody does have any more questions or comments, Phyllis is saying the miasm is needed to be released from the system of the individual so that they do not pass them on. The epidemic disease has shown to be needed to be experienced to release these triggers to the miasmatic issues. That's a kind of advanced question. I'm sorry, I'm kind of looking at another screen in order to read it, and so I'm not on the show directly. But
Can I just say that look, the Chinese medicine, for example, loves people to get measles because they think that that really stimulates the immune system and helps it to mature.
Okay.
And I don't disagree that a well-managed infectious disease will certainly help the immune system to mature. And that's why in my own program, I don't even try and cover every disease. I don't cover things like measles, mumps, rubella, chicken pox, etc. People can add that in if they want to. It's the parent's choice and it's their right to choose. But the one thing I would say to that the person whose comment you read out, I have never ever seen anywhere any proof that unless a person gets a particular infectious disease, they will not be healthy. So I don't agree with the conclusion of that comment. Now, I think it's very important that we are not afraid of simple infectious diseases. And we shouldn't be, particularly if we've got healthy children and we have homeopathic care on hand to deal with it. I mean, if I was a parent of a starving child in remote Africa and I saw my child likely to get measles, I'd be terrified because it can kill them. There's nothing about releasing a miasm there. If a child's immune system is severely compromised, simple diseases or diseases which are simple to healthy people can be fatal because the system is just not able to deal with it. The other thing is, just going back to that person's comment, and look, I appreciate the comment. The other thing is, if you challenge the immune system using a high potency particularly with a nosode, you are actually stimulating and allowing some form of release. And this is, as I said, why Hahnemann said that doing appropriate provings can be beneficial, and why my data showed that the HP group were equally as healthy, and in some categories more healthy, than the constitutionally protected group. And that really does suggest that the challenge put on by an appropriate homeoprophylaxis program is actually beneficial to people. And the releasing of the miasm, as the other person said, could be one explanation for that.
Great. Amnon, you're going to give us a cue about how long we're going to be able to talk today.
You decide.
Okay, so I mean, I'm willing to go longer.
That's fine. That's fine.
If you're up and we have important things to talk about. Anne on the chat did ask earlier at the beginning of the show whether you were planning to come to Europe. I think it is.
Yes, I'm actually I'm doing a lecture in Canada early August, and then I'm going back to Cuba for 3 weeks to collect more data. And on the way home, I'm doing another talk in Wales. So the Welsh Homeopathic Association have got me talking there early September. So I don't. For those of you in America, if anyone wanted to pop up to Toronto, I think it's the second Sunday in August. But if people want to know, they can just email me and I'll let them know. Then I'm doing a day there, and for people in United Kingdom or Europe, I'm doing talking over 2 days at the Welsh Homeopathic Conference. The first, I think it's the 6th and the 7th of September. Yeah, so I actually, this year I can say yes.
Okay, and if you give us that information, I'll post it on Homeopathy World Community. I see
Thank
that, yeah, my husband is asking if doing these proofings is what Dr. Will Taylor calls them. He doesn't like to use the word proving anymore. If they induce a form of a kind of immunity, and I think that's really the purpose, the whole purpose of stimulating the immune system in a very gentle, non-toxic way that either the individual will have a sensitivity to a particular remedy or a nosode, that there might be a primary and secondary action of the body of the individual, whereas somebody who's not going to be affected by that remedy will just pass through them. Is that correct?
Yeah, very much so. In fact, when I looked at adverse reactions to people using my long-term program, there were only recorded reactions in 2% of doses. So, the most common reaction is no reaction. And this is exactly, what we expect if a program is managed appropriately. And this is comes back also to the question about provings, because if you were giving too many doses of the same remedy, you would get definitely more reactions. There's no two ways about that. And so that's why I say I'm very comfortable with saying that an appropriate homeoprophylaxis program will not cause any long-term energetic damage. It may, in very few numbers, cause some short-term discomfort like restlessness, runny nose, a bit of a skin rash, things like that, usually resolved within 24, 48 hours. And the evidence suggests that it is positive to long-term health, not negative. So it just depends on the program, and if it's a well-constructed program, there shouldn't be any problems with it. And you see, the thing about that, Debbie, this is when the reason why this is important is that when we come to questions about, okay, when do we know if there's an epidemic, and therefore for some people we can use homeoprophylaxis? Well, my point is, with something that's around in the background all the time and you never know when it's going to flare up, like, say, whooping cough, then because we know that it's highly unlikely that there'll be anything negative coming from the homeoprophylaxis program, you can use it any time at all because you know that it's safe, it's not going to cause harm, and certainly you don't need to wait for a small cohort of children to fall unwell before you start preventing.
Right. And there are a lot of in the news things like outbreaks of whooping cough today, or even measles, and I've heard a bit about mumps. And what about the major problem of tuberculosis and not having orthodox medicine be able to handle it, resistant strains, and these kinds of things?
Yep.
Are you finding that the communities, and I assume these are really small communities who are going through the homeoprophylaxis programs? You know, we're talking as if everybody's getting it, but in actuality, this is really small numbers of people.
Yep, very much so. Yep. So, sorry, what was your question there?
My question was about the news about epidemic or contagious diseases that are coming up in pockets of communities around the world, in America, in Australia, the whooping cough in particular,
Yeah.
or things like that.
Yeah, well, we know in Australia the reason why the whooping cough numbers have gone up significantly over the last 2 or 3 years is because the strain of whooping cough has changed in the community, and therefore the strain in the vaccine and the strain in the community are now different. And with vaccines, unlike homeoprophylaxis, you need a very close match of the strain. The antigen in the vaccine needs to be very similar, the identical strain ideally of the antigen in the community. With homeopathy, we're lucky because we just need a similarity of symptoms. See, homeoprophylaxis is based on the law of similars. Therefore, as long as two different strains produce reasonably similar symptoms, then it doesn't matter which strain you use in homeoprophylaxis, but it does with vaccines. So I'm not sure if that was the question you were actually asking, but certainly in Australia, the whooping cough numbers have gone up, and they're mainly in vaccinated children.
And they're mainly in vaccinated children. And this is information that I assume the mainstream media is not getting out to the public.
Well, they're getting out that it's the incidence is going up, but I don't think they're actually saying an awful lot about it being in mainly vaccinated children. But when you actually read the data from the health department, you know, you can see that a few times that when they're doing studies where they actually differentiate between vaccinated and unvaccinated, that there's been a big spike in the vaccinated numbers because, as I said, the vaccine is not covering the strain that's now circulating in the community nearly as effectively as it did before.
Right. And one other point for those who are new to this, the diseases, these contagious diseases, may be spread through children who receive vaccinations as they are carriers.
Yeah, that's an interesting point, that one. Like, certainly with oral vaccines, there's no doubt about that. It's interesting. I took out polio from my main homeoprophylaxis program a couple of years ago because for the last 4 or 5 years at least now in Australia, we've been using injected polio vaccine, whereas prior to that, everyone was being given oral polio vaccine. So I know in America you use injected polio vaccine. So prior to that, the very, very few cases of polio in Australia were contactees of recently vaccinated children, because someone who's given oral polio vaccine excretes some of it in the feces, and if there's not good hygiene, then it can be transferred to other people. Whereas I personally believe, and the evidence that I've seen suggests quite clearly that the vaccinated injected vaccine is much less likely to cause problems in contactees. It's more likely to cause problems in the actual vaccinated child, but it's much less likely to spread to other people. So certainly it's not impossible, particularly with viral vaccines, that a recently vaccinated person can spread it to other people, but it's not common.
But if the disease is the children who get the vaccines are coming down with the disease, and there is a period of latency for the symptoms to show up, and the kids are going to school and they're not well, and they have started to have the disease, then they are exposing the other classmates.
Yeah, but I think the point is, say, with the whooping cough one, the reason why the children are getting the disease is not because the vaccine's causing it, is because the vaccine is not preventing it. So in other words, the disease is in the community, and whereas previously when there was a better match of the antigen in the vaccine and the antigen in the community, it was giving a higher level of protection. Now that the two don't match, it's now giving a lower level of protection. Therefore, I think that's the main reason why there are more children coming down with whooping cough, not because the vaccine's giving it to them, but because it's not protecting them.
Right. And I think I read something similar about the measles as well, and all of the influenza shots that are being given.
Oh, well, flu's always typically one of the least effective vaccines. I mean, efficacy for flu vaccines ranges between about 40 and 60%. And some people would say that's being generous. So it's never a highly effective vaccine. The measles vaccine is claimed to be one of the most effective. The NHMRC in Australia basically claimed that after 2 shots of the measles vaccine, there's 99% efficacy. Of course, when you actually look at outbreaks of measles in highly vaccinated communities, there's a real question about something like 99% efficacy. There's quite a bit of evidence out there when you look at outbreaks of measles in heavily vaccinated communities that it could be quite a bit less than that in if you like, wild, real world situations as opposed to controlled clinical situations. And the other thing is, of course, you can always get bad batches of vaccines, and therefore some batches will give less protection. But, you know, I'm always happy to, when I debate people in orthodox medicine, I'm always happy to use their best measures, their effectiveness, even though they may be overstatements of the fact, because what we can offer with homeoprophylaxis is just as good. So, you know, rather than waste my time arguing with them whether measles vaccine really does have 99% efficacy or whether it's 69 or 79, I'd rather say, okay, I'll take what you claim and look what we can do. It's just as good. You know,
right.
We've got measures of efficacy in the 90s.
Do you want to give us some good report from what's happening in Cuba?
Well, I haven't been. I'm going there.
Oh, you're going there?
Yeah, so I hope I'll have a lot more new material to report. I mean, I've written up a lot about the Cuban experience in my books on the topic and in a lot of articles. But I mean, the Cuban experience is I count it as one of the true blessings in my life, being able to experience that for a number of reasons. One is that their whole health system, with its openness and its willingness to use whatever is best for the patient, is just a wonderful thing to see, particularly coming from a very narrow health system like Australia's is. Australia, I think, follows the American system quite closely, very much based around pharmaceutical medicine, very heavily controlled in this country by people who are wedded to an apologist for pharmaceutical medicine, who are basically trying to eliminate complementary medicines, not just homeopathy, but all complementary medicines from the scene. and you go to a place like Cuba and you see that the doctors in the clinics and in hospitals are free to use whatever modality is needed, whatever's best for their patients. So if it's drugs, it's drugs. If it's herbs or nutritional medicine, homeopathic medicine, TCM, acupuncture, whatever, they're able to do that. It's a wonderful system and they get great results as a consequence. And also, by the way, they save a hell of a lot of money because our health system, like yours, is becoming unaffordable. You know, we have an epidemic of chronic illness in both our countries, and our percentage of health expenditure to percentage to GDP is just growing to a point where it's simply going to be unaffordable. And what these idiots who run the bureaucracies, the health bureaucracies, don't realise is that they can actually solve their budgetary problems by really making integrative medicine the mainstream, not something that patients have to sort of sneak around corners and not tell their doctors about. Sorry, I'm getting on a high horse now. And probably
I love it. That's my favorite part. This is what I come to hear. Do you want to tell folks on, I think it's slide number 5, that survey number 1 is still open?
Yes, please. Yeah,
Okay,
I'd really appreciate it. And it's got my web site there. And if people can go to that web page, I'm sorry, because I rushed to get to this, I haven't set up my technology so that I can either see you or see the slide that you're showing up. But if you could show that, I'd be most appreciated. And look,
yes.
I really would encourage everyone out there, whatever their view, whether they're against homeopathic immunisation or for it, to participate, because we want to hear from everyone. We want as many genuine opinions as possible. So the first survey we're going to finish at the end of April, and that's when our data collection finished, but we got ethics committee approval to continue it to the end of this year, so it's going to remain open. And if we can triple the numbers rather than 770, if I can get 3,770, that'd be wonderful. So please respond. And then the second survey, all well and God willing, it'll be coming out in about 3 weeks. And if people just keep an eye on my site there, then they'll see that and be able to link to that. And that'll be even more interesting because the people who have asked questions about the genus epidemicus remedies, about when is there an epidemic, when should we start using prophylaxis, they're the sort of questions we're covering in the second survey. And so it's going to be really very, very interesting to drill down into some of those potentially contentious issues. And by the way, there is a free article which the editor of Homeoprophylaxis, the editor of Homeopathic Links made available. And if people would like to get that, it's an article I wrote for Homeopathic Links at the end of last year. But you can get it for free. And if people would like to access that, if they just want to send me an email, I can send them the link. When I can send it to you later on too.
Right. You can send it all to me and I'll put it up on the website.
Fantastic. Thank you.
Yeah, I see, not only do we have attacks on homeopathy in Australia, which are pretty mean and heavy. They have a lot of financial backing against that. Is that the NHMRC draft information paper you want folks to get to?
So let me talk about that for just a moment then. So the NHMRC is the National Health and Medical Research Council. They're the peak medical body in Australia. And they have recently published a draft report demonstrating that homeopathy doesn't work. But they did it by eliminating anything to do with health and well-being. They eliminated, by definition, anything to do with preventing illness. They didn't look at the cost benefit of homeopathy. In other words, in practical health situations, what are the cost savings from using or from a person using homeopathic treatment? And they didn't look at safety and quality issues. And these are all things that the NHMRC were asked to look at, and they only focused on a very, very narrow definition of efficacy. They only looked at prospective controlled trials. And then they made quite a remarkable statement. They said that there were no high quality randomized controlled trials of homeopathy, yet they commissioned a research group to do their grunt work. And when you actually read the report of the research group, they actually identified dozens of high quality trials that are favourable to homeopathy. So basically, they began by defining what they would accept, what information they'd accept, defining away virtually everything that had to do with health, healing, and that was positive for homeopathy, and that when things came up that were positive within their own definition, they excluded them, most of them. And this is quite remarkable when you think that this is the peak scientific medical science body in Australia, that they would bring out a report, like that. It really just shows that it was a report totally designed to support the old pharmaceutical paradigm, the old paradigm of treat sickness rather than create health. And, Debbie, there's an old saying in statistics, if you want the right answer, ask the wrong question. And that's exactly what these guys have done. And it's so patently obvious that initially, when I think a lot of us saw the report come out here, we thought, oh my goodness, this is pretty dreadful. But then when we saw how blatantly biased the report was, well, unfortunately, people in the media don't understand that. A lot of mums and dads won't understand it. But people who actually look a bit more carefully and people who are genuinely scientific in their inquiries will see that this was, just a very, very expensive and a very disappointing attempt to get the answer they wanted against homeopathy. And I think it'll come back to bite them, to be honest with you.
Yes, I'm with you there. I'm going to interject a statement that I'm going to read from this article on SciDevNet. Because I feel like this is across the board the way science is today and medicine is today. The name of this article is called G77 Warns Against Misuse of Science in Development. And the quote here from the article says, "Science, technology, and innovation must be used to advance rather than undermine development, and developing nations should not be blocked from acquiring affordable technology or from benefiting from their genetic resources. A major political grouping of developing states has warned. The heads of state and government of the group of G77 and China have issued a declaration following a summit in Santa Cruz de la Sierra, Bolivia. This was in June 14th and 15th of this year, marking the 50th anniversary of the group's creation. Basically, the G77's mission includes promoting global, social, and economic equality and advancing the interests of the developing world. And in a way, I feel like this issue of building communities, building health, building equality and freedom to choose whatever kinds of health and environmental sustainability, we must have a grassroots of people to stand up for this, because otherwise science can be manipulated, as you have shown with this article, that conclusions do not actually match the data that is being found out and unearthed from the researchers. So I think this is a really wonderful point that you brought up for people to read about.
Look, the other thing, that's lovely. And the other thing, and I think I might have it on another slide, is that the World Health Organization last year published the WHO Traditional Medicine Strategy 2014 to 2023. And as I said, unfortunately, I can't access the slides I sent you, but I think I might have referred to that. But I would highly recommend, people to have a look at that. It really is a very, very positive document for complementary medicine around the world. They have a wonderful conclusion there, which I'm just trying to find, but I don't seem to be able to get to it quickly, where they talk about the importance of complementary medicine in general in healthcare systems around the world. I'll just read it. You mind if I just read a little bit from the foreword? They say traditional and complementary medicine is an important and often underestimated part of healthcare. TNCM is found in almost every country in the world, and the demand for its services is increasing. Traditional medicine of proven quality, safety and efficacy contributes to the goal of ensuring that all people have access to care. Many countries now recognise the need to develop a cohesive and integrative approach to healthcare that allows governments, healthcare practitioners and, most importantly, those who use healthcare services to access TNCM, or traditional and complementary medicine, in a safe, respectful, cost-efficient and effective manner. A global strategy to foster its appropriate integration, regulation and supervision will be useful to countries wishing to develop a proactive policy towards this important and often vibrant and expanding part of healthcare. Now, the World Health Organization says something like that, and the clowns running orthodox medicine in this country, and it's probably not much different in yours, are saying the complete opposite. I mean, how different can that wonderful statement be from the World Health Organization, who, by the way, every now and again have their own little issues? But that's where we need to be going. We need systems of medicine which are inclusive, which integrate all of the modalities and use the best of orthodox medicine, but the best of all the things that we do as well. And that's when people are better off than they otherwise would be. And that's when we can start, really practicing preventative medicine and controlling costs and not allowing healthcare to control budget expenditure and give everyone access. That's what my firm and passionate belief in these days, Debbie. Trying to get things like that known and understood.
Yeah, I appreciate your focus, devotion, and passion in this area. I very easily get swept up in so many of the needs today out there. For instance, in America, we don't have GMO, genetic modified organism labels on our products. We have such a powerful dominating force by industry and business that we really must resist. We must be the changing new strains. we have to, the people must be able to overcome the domination of these, the industry, to telling us what we cannot know or do with our lives. I appreciate everything that you are continuing to do, and I hope that you will come back again with our time more aligned, because I know it's really difficult to connect over the other half of the world over there in Australia and in New York City area, the America and the East Coast. Is there any other thing that you want to make a special point of today before I announce the upcoming shows?
Look, no, I don't think so. I mean, look, once again, I'd like to apologise to all the folks for me making, getting the times not clear in my own head. I'm sorry that I wasn't here. Punctuality is a fetish of mine, and so I'm now going to go and beat myself up for the next week, very softly, of course. But if there are a lot of questions arising, particularly about the homeoprophylaxis issue, and it sounded from what you were saying there might be a few. If you'd like me to pop back in a more organised way next time and deal with the questions very specifically, we can start off by doing that. I'd be very, very happy to do that. Because there is a lot of information coming out of this survey, and we're about the guys at the university I work with are mathematicians, and they're going to do a very special analysis on some of the data that we've collected using techniques that I'm just not competent with, and they'll bring up other stuff that'll be new and interesting as well. But certainly it's made me aware again of the differences of views among homeopaths and other practitioners about immunisation, and I know that a lot of these differences can be resolved if we can talk about them, and I'd love to do that again sometime, Debbie.
That sounds great. I feel like there's a huge topic also of how this small community of natural health practitioners, naturopaths and homeopaths and all the other alternative and integrative physicians and practitioners, how we move and speak to those in the allopathic, traditional, conventional, what we call conventional medicine arenas, and opening up the scope of information to the general population who really do not even know about this option. So I think that's going to be the next wave that's going to happen, probably from countries who are integrating it more into their general medical system.
Yeah, I agree.
Okay, so upcoming June 30th, we may be having an expert in the bees. June Stoyer would be talking about the neonicotinoids and what's happening to our resource of pollination of all of our living foods and source for the health in the environment. And then on July 7th, Dr. Saurav Arora, who has the website oddsapier.in. He is gathering all the documentation about evidence-based cases in homeopathy and what he has to say to us about that. July 14th, Carolyn Vessel is going to be talking about the Sufficiency C. It's a green tea vitamin C drink, completely organic, that is very tasty and easy to give to your family. There's a link on Homeopathy World Community about that drink. And it's going worldwide as far as I know. This one little lady in Pennsylvania is really gung-ho on it. On either July 21st or July 28th, we're going to most likely have the Joshis come. People love to hear this team duo of homeopaths and their approach to healing using the sensation method. And we're going to have Jeremy Sher tune in from Tanzania on August 4th. Oh my gosh, I've got such a great lineup. I'm not going to even tell you everybody right now. And if you know of any homeopath or health practitioner you'd like us to interview, give me a ring at homeopathyworldcommunity@gmail.com, and I'd be thrilled to connect with them and have them as a guest. We want to thank all of our listeners, Michelle, Penny, Phyllis, Catherine, Ann, Karen, Amnon, Dr. Bob, and Kathy. Jay, I don't know who you are, and all those who have popped in and out during the hour and a half that we've been on today. Dr. Golden, it's such a treat and a pleasure to speak with you, and we will line you up for another date in the future. Amnon, thanks for being the producer of this fabulous Health In show, which typically broadcasts each Monday at 11 a.m. Eastern Time. And I want to wish everyone great health, really good health, and take your time, be gentle with yourself, Get out in the sunshine for a little while, get your vitamin D, drink lots of fluids. I know there's a heat wave going on. Get your rest, take a siesta, have good, healthy food and good, healthy relationships with all of your loved ones. And so we will be back again next Monday. Thanks for tuning in. Love you all. Bye-bye.
Bye.
You are tuned to the Nissan Communications Network. Our weekly lineup of call-in programs includes Computers 2K Now with Amnon Nissan, Health In with Debbie Bruck, Breaking Free with Marilyn Shannon, Lessons of Vietnam with NCVVI members, The Tanya Love Show, Reawaken Your Brilliance with Julie Seibert, and if you tuned in too late, you can always watch each program in its entirety or download an MP3 audio file of it at www.nissancommunications.com. Sponsored by Atomus.com, makers of quality video recorders and converters for professionals. That VidBlasterGuy.com, CarolinaApparel.com, and DeltaForce.net.